Ulnar Impingement Syndrome, or UIS, is a condition affecting the wrist. It causes pain on the pinky finger side. This happens when the ulnar bone, which is on the pinky side of your forearm, rubs against the radius bone in your wrist. Imagine two gears grinding together. That's similar to what happens in UIS. This rubbing is often due to a previous injury, like a fracture, that made the ulnar bone slightly shorter. Sometimes people are born with a naturally shorter ulnar, which can also lead to UIS. This constant rubbing can cause pain, inflammation, and even damage to the wrist joint. UIS is different from ulnar impingement syndrome, though both involve the ulnar. In UIS, a shortened ulnar is the culprit. In ulnar impingement syndrome, a longer than normal ulnar is the issue. Both conditions can cause pain and discomfort in the wrist, but understanding the difference is key for proper diagnosis and treatment. Ulnar impingement syndrome typically announces itself through pain on the pinky side of the wrist. This pain often worsens with activities that involve rotating the forearm, like turning a doorknob or using a screwdriver. You might also notice pain when you grip objects or bend your wrist towards your pinky finger. Along with pain, UIS can cause a clicking or grinding sensation in the wrist. This is the sound of those bones rubbing against each other. If you experience these symptoms, especially after a wrist injury, it's important to see a doctor. Early diagnosis and treatment can prevent further damage to the wrist joint. Treating ulnar impingement syndrome often starts with conservative measures. Rest is crucial as it gives the inflamed tissues a chance to heal. Applying ice packs to the affected area can help reduce pain and swelling. Your doctor might also recommend over-the-counter pain relievers or prescribe stronger anti-inflammatory medications. If conservative treatments don't provide enough relief, surgery might be necessary. The type of surgery depends on the underlying cause of the impingement. For example, if the ulnar bone is too short, a surgeon might perform a procedure to lengthen it. In other cases, surgery might involve removing or reshaping a small portion of the ulnar bone to prevent further rubbing. Preventing ulnar impingement syndrome often involves taking care to avoid wrist injuries, especially fractures. If you do experience a wrist injury, it's essential to seek prompt medical attention and follow your doctor's instructions for rehabilitation. This can help ensure that the bones heal properly and reduce the risk of developing UIS later on. For those already diagnosed with UIS, long-term management typically involves avoiding activities that aggravate the wrist. This might mean modifying certain work tasks or finding alternative ways to perform certain actions. Regular stretching and strengthening exercises can also help maintain wrist flexibility and strength, reducing the risk of future problems.